Hi there, I'm Suzette Kroll, registered dietitian. I'm your personal nutrition guide. In this session, I'm going to talk about the single most important skill necessary after surgery. And it is, let me have a drum roll here, please. Learn your body cues. That's right, learn your body's cues because there is no one-size-fits-all answer to the question, how much should I be eating? You're going to ask and you're going to wonder if you're eating too little or too much. You're a month out of surgery, 2 months, 6 months, a year, and you're going to be wondering, should I be eating a quarter cup, half cup? But again, there's no exact one-size-fits-all answer to this because you're going to be able to eat different amounts of different kinds of food, number one. You'll be able to eat more soft, mushy food like plain non-fat Greek yogurt than solid, dense food like chicken. And you'll be able to eat different amounts as time goes along. So you'll be able to eat more at 6 months and a year than you did at 1 month. And so there's no exact calendar here either saying you should be able to eat this much at 1 month, 2 months, 6 months, or 1 year, because everybody heals and progresses a little bit differently. So the best thing you can do is learn to pay attention to your body cues and learn to stop eating when you're full. And in general, live by the rule of thumb, no shoulding on yourself. There is no should. Full is going to feel different after surgery. You might experience shoulder pain, back pain, sneezing, excessive salivation, or hiccuping. And if you're eating quickly, if you're eating mindlessly, you're likely to miss these cues and then overeat and either feel sick or get sick. So the only way really to learn your body cues is to eat mindfully. And this involves, first of all, getting the food cut up into small little pieces, the size of an eraser or a peanut or a bean, before you start eating. Cut the entire plate up into tiny little pieces, just one time, one and done, rather than having to remember this every single bite. You're more likely to succeed this way in taking small bites each time. It's very helpful to use small utensils. A small bite looks nicer on a small cocktail fork or a baby utensil than a large dinner fork. So get some small utensils and then take your bite and then put your fork down on the table and put your hands down in your lap. So fork down, hands down is a good mantra to live by. And then chew your food up. Chew very thoroughly. If you wanted to count bites, 25 to 30 chews per bite is a good guideline, or simply chew until your food is applesauce texture. And then swallow the food and sit there and pause a minute. You want to wait a full minute between bites. You can either use your phone as a timer or get a 1-minute sand timer to make sure you're waiting long enough. And it's in this pause time that you're going to determine should you take the next bite. It's in this pause time that you're going to be paying attention and learning your body's cues. And so then you repeat this again. Take a small bite, fork down, hands down, chew, 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 swallow, and pause. And then repeat, and repeat again, and repeat again until you notice those feelings of fullness. When you're eating mindfully, there's not a decision ahead of time how much you're going to eat. You cannot predetermine it's a quarter cup or half cup. It's in that pause that you're going to determine, do I need another bite? So instead of worrying about how much to eat, practice how you eat. This truly is the single most important skill after surgery. Eat mindfully, learn your body's cues. That's it for now. I'll see you in the next session. I'm Suzette Kroll, registered dietitian. I'm your personal nutrition guide.